Well, good afternoon. Joining me today are Secretary Kelly Schulz of the Maryland Department of Commerce and Dr. Tom Inglesby, a member of our Maryland Coronavirus Response Team and the Director of the Center for Health Security at the Johns Hopkins Bloomberg School of Public Health, who just published a Principles for a Phased Reopening for Johns Hopkins. Over the past several weeks, we have been consulting with leading experts and public health scientists like Dr. Inglesby, public health expert, and former FDA Commissioner Scott Gottlieb, and other members of our coronavirus response team. He was an advisor to the President's Coronavirus Task Force and authored the American Enterprise Institute's Roadmap to Reopening. We've been working with both of them and our larger team of experts to develop a well-thought-out, safe, effective, and gradual roadmap to recovery for Maryland. On Wednesday, in my role as chairman of the National Governors Association, I released an NGA report giving guidance to all of the governors across America regarding how to safely open their states. Maryland's roadmap to recovery, which we are launching today, utilizes the guidelines which were issued by the White House last week, incorporates many of the principles of my NGA plan, and much of the work of the plans released by AEI and Johns Hopkins. We also solicited input from our team of scientists, public health and business experts, and our multi-agency state government coronavirus team in order to create this roadmap for the recovery of Maryland. The result is a well-thought-out, gradual, safe, and effective path forward for the people of our state. The federal guidelines issued by the President last week call for states to meet specific gating metrics before considering lifting restrictions. That includes a 14-day downward trend in key numbers. Here in Maryland, we took some of the earliest and most aggressive actions in the nation to slow the spread of COVID-19. Because of those efforts of everyone, we have far fewer cases, hospitalizations, and deaths than all of the models we're calling for. We have been successful in flattening and lengthening the curve in our state, and we have not had the very high spikes that you have seen in other states. But that is also why we are several weeks behind those other states who spiked and peaked earlier. The number of new cases of COVID-19 is still rising here in Maryland and throughout the Maryland, D.C., and Virginia region. And by the federal standards instituted last week and under the guidance given in the studies and reopening plans that we cited, Maryland is not yet able to lift our restrictions. We are dramatically increasing the amount of testing here in Maryland, and as a result, we are going to continue to see the number of total cases increasing. So for the purposes of our planning, the key numbers that we are most focused on are the rate of hospitalizations and the numbers of patients being admitted to ICU. We are watching these numbers very closely on a daily basis. And when we start to see that downward trajectory or a consistent plateauing of those metrics, that can put us in a position to consider lifting the stay-at-home order and beginning our gradual, safe, and effective recovery plan. As I discussed on Wednesday, we have made considerable progress on all four of the building blocks which needed to be firmly in place before we could consider lifting restrictions. First, we have exponentially expanded our testing capability. Second, we are exceeding our goals to increase hospital surge capacity. Third, we are making progress in increasing the supply of PPE. And fourth, we have quadrupled our capability to do contact tracing by building a robust force of 1,000 contact tracers and launching a state-of-the-art contact tracing platform called COVID Link. Having these 4 building blocks or pillars in place gives us the public health infrastructure to try to attack this virus from every direction. And this has allowed us to be in the best position possible to begin our reopening and recovery just as soon as we reach the necessary trends in the critical metrics. I'm optimistic that if Marylanders continue staying home and continue practicing physical distancing a little while longer, that our numbers could continue to plateau. And I'm hopeful that we could then be able to begin our recovery in early May. Our Maryland Strong roadmap to recovery has 3 stages. Stage 1 would begin by lifting the stay-at-home order, and it would include the reopening of many of our small businesses. We would be able to restart many of our lower-risk community activities and quality of life improvements. Changes that could occur during our first stage would include the reopening of certain businesses and retail shops, the reopening of golf courses and recreational boating and fishing, tennis, outdoor religious activities, along with outdoor fitness and gym classes, and the resumption of elective outpatient surgeries and procedures in certain counties with lower concentration of cases. Local governments could also have additional flexibility to open things including local parks and playgrounds, municipal recreation centers, and libraries if they deemed that appropriate safety protocols could be followed. These decisions would be based on the ability to continue physical distancing and to continue to limit person-to-person contact. If stage 1 activities resume successfully without a spike in deaths, a sustained spike in ICU cases, or significant unforeseen outbreaks of community transmission, we would then be in a position to move into stage 2, where a larger number of businesses would open, non-essential workers who cannot telework could return to work, and other public activities would be able to come back online. Indoor religious gatherings could resume with perhaps limited capacity and physical distancing measures. It would include raising the limits on the number of people in social gatherings, perhaps the returning to a more normal public transit schedules, and the opening of restaurants and potentially bars with significant safety restrictions. And then the third and final stage would be reinstituting higher risk activities such as larger social gatherings, events, religious gatherings and activities at entertainment venues, and a further lessening of restrictions at hospitals and eventually nursing homes. I want to stress that each of these recovery stages will need to be instituted in a safe, gradual, and effective manner. If we try to rush this, and if we don't do it in a thoughtful and responsible way, it could cause a rebound of the virus, which could deepen the economic crisis, prolong the fiscal problems, and slow our economic recovery. Look, I'm a lifelong small businessman, and the entire focus of my administration has been growing the private sector, creating jobs, and turning our economy around. It's the reason I ran for governor. And it breaks my heart to see so many Marylanders struggling and going through so much economic pain. So let me be very, very clear. Other than keeping Marylanders safe, saving lives and defeating this hidden enemy, there is absolutely nothing more important to me than getting people back to work, getting our small businesses reopened, and getting our economy back on track. And I want to assure you that we are going to do everything we possibly can to do that just as quickly as we possibly can in a safe way. In the days and weeks ahead, we will continue to be open and transparent, and we will continue to keep Marylanders as fully informed on the facts as we possibly can. Since day one of this crisis, we've been making our decisions based on the best advice of an incredible coronavirus response team, which includes some of the smartest scientists and public health experts in the world. And as we move into this recovery phase, we're going to continue to rely on their advice and also on the advice of some additional business and economic leaders. Our coronavirus response team has now transitioned into a coronavirus recovery team with some additional distinguished leaders who have joined this effort, including my partner in government, Lieutenant Governor Boyd Rutherford, who has been a major part of all of our efforts, Arne Sorensen, the President and CEO of Marriott International, who is the co-chair of the COVID-19 Task Force of the Business Roundtable, Robert Doerr, the leading economist and the president of AEI, the American Enterprise Institute, Kevin Plank, the executive chairman of Under Armour and a trustee of the University of Maryland Foundation, Jim Davis, the chairman and co-founder of Allegis Group, the largest staffing firm in the United States, Mark McManus, who is the general president of the UA, the United Association, which represents 355,000 members of the building trades in local unions all across North America, and Augie Chisera, who's the president of M&T Bank's Baltimore and Chesapeake regions, and a board member of the Economic Alliance of Greater Baltimore. The coronavirus recovery team will be advising us and helping guide our real-time decisions on Maryland's recovery and reopening process. We have also assembled 15 industry-specific advisory groups, which will be coordinated by our Department of Commerce and the Governor's Office of Community Initiatives. Leaders from key industry sectors, including small businesses, retail, restaurants, financial services, construction, manufacturing, and many more, as well as representatives from churches, faith-based organizations, service organizations, and nonprofits, are developing plans with proposed recommendations and guidelines determining how their industries can reopen in a way that can keep their employees, their customers, and the public safe. I want to stress that even as we begin our recovery, we won't be able to just flip a switch. Unfortunately, life is not going to just immediately go back to normal. In fact, it is important to recognize that until a vaccine is developed, the way we go about our daily lives and the way we work is going to be significantly different for a while longer. But as we begin to reopen, it will continue to be important for Marylanders, particularly older and more vulnerable Marylanders, to continue to stay home as much as they can. And all Marylanders should continue to avoid crowds and gatherings, and they should continue to practice physical distancing and to take precautions to protect themselves, their families, and their fellow Marylanders. The full details of our Maryland Strong Roadmap to Recovery, the federal guidelines, the NGA plan, as well as the AEI and Hopkins reports are all available at governor.maryland.gov/recovery. Together, we are going to defeat this deadly virus, and together, the state of Maryland will return stronger and better than ever.